Hi, I'm Dr. Britt Talley, neurologist in Dallas, a writer, a blogger. I have written a book on carpal tunnel syndrome, which is on the internet. I've been doing a series of YouTube videos on carpal tunnel syndrome. This is an article on what it's like to have carpal tunnel surgery, because I personally have had it in the past. Now, carpal tunnel syndrome is found in 10% of persons in the world, and it's the most common entrapment neuropathy in the world, which involves the median nerve at the wrist, right here. It relates to the fact that persons are born with a small carpal tunnel, and those people, if they do certain activities with their hands, will get the symptoms of it. And women have 3 to 4 times more carpal tunnel syndrome than men do because they have a smaller carpal tunnel area. Now, I use my hands a lot because I'm a writer, a blogger, I play the guitar, things like that. And so activities with your hands can aggravate the symptoms. And as a neurologist and electromyographer, which is a doctor who does the test for carpal tunnel syndrome, where we shock the nerves in the hand and see if you clinically and electrophysiologically have a syndrome. I've done and seen thousands of patients with carpal tunnel syndrome. Now, my symptoms were about 10 years of pain, numbness, and tingling, mainly in the first, second, third digits of my right hand, and I am right-handed. There was some pain, had a little bit of symptoms on the left side, and I would wear a neutral splint, which hold the hand straight out. And the deal on a splint, if this were the carpal tunnel, which is in the wrist here, when your hand's straight out, the tunnel is open, but when you flex it, it closes the tunnel. So negative splint holds the hand straight out and can treat carpal tunnel syndrome, and that would help, but I got tired of wearing the splint. And so then I had my nurse at the office give me 3 shots of cortisone in the wrist right here. And I've got an image of what the injection looks like here. So you can see it. It's a little needle in the wrist. And I tell my patients, when you inject a needle with a cortisone in the wrist here, it hurts like fire for about 30 to 60 seconds while the injection is going on. And then it seems to stop. Oh, the hand kind of hurts a little bit and feels numb. And it takes about 1 or 2 days for the cortisone to kick in to make the nerve shrink so it's not so big and occupying so much room in the carpal tunnel, and the patient feels better then. So part of what happens with carpal tunnel syndrome, if this is the tunnel again, and my finger with the nerve, is the nerve, the carpal tunnel, the tunnel is small, and the nerve gets swollen. You give a shot of cortisone, and that gives it more room in there, and that's how that works. And many patients would have 1 or 2 shots of cortisone. I'd see in my office, they did really well. I never see them again. They must have done well with it. And I did well each time I had a shot of cortisone for a month or 2, but then the symptoms came back. So finally, I decided to get an EMG, which I did myself, and shocking the median palmar sensory nerve through here. You shock the nerve, the wrist, record from here. And the normal value for that little sensory nerve is 2 milliseconds, 2.2 milliseconds, and mine was 2.0, which is normal, so I didn't think it was going to be that bad, but still, I was doing limiting movement of my hand and resting it. I was using splinting and conservative management. The other part of that is cortisone injection. Still, I had problems. So I decided to see an orthopedist hand surgeon in Dallas, where I work. Now, 30 years ago, the persons who operated and dealt with as surgeons carpal tunnel syndromes was a melee of different doctor specialties, such as plastic surgeons used to do it, occasionally neurosurgeons would do it, general surgeons would do the surgery for it, and general orthopedists. But in the last 10 or so years, particularly in a big metropolitan city like Dallas, we only send patients, and most of the surgery is done by orthopedic hand surgeons who have specialty training. So she agreed I had carpal tunnel syndrome and scheduled me for day surgery, which was done as an outpatient. My wife drove me to the clinic where I was going to be. They gave me some medication, so I was a little drowsy. There was an anesthesiologist there who put a block on my hand, anesthetic block on my hand, so I couldn't feel anything. And the surgery took about 30 minutes. My hand surgeon told me afterwards that I had a persistent median artery that went in through the carpal tunnel, which 6% of persons have. And so this little artery was occupying space within the carpal tunnel along with the median nerve. And so I really never was going to get better with conservative management. So the surgery lasted about 30 minutes. I went home. I was offered different painkillers, but I really didn't take Talley or Advil or anything. I didn't need anything, really. I had a little splint on my hand and a dressing, which I wore about a week. Then I saw my hand surgeon at a month, and I was doing well. And since then, I've done really well and hadn't had any symptoms with it at all. Now, training in neurology at the Mayo Clinic, the Mayo Clinic says that the most successful surgeries of all surgeries is surgery for carpal tunnel syndrome. And about 94% of patients who have surgery for carpal tunnel syndrome will do well without a lot of symptoms. Again, looking at the treatment of carpal tunnel syndrome, you should consider that 90% of patients are treated conservatively, again with resting, splinting a couple of months, and then 1 or 2 injections of cortisone in the wrist. If they fail that, then those are people who have to have a surgery. So right now I can't even see the scar on my wrist. I've done really well. I'm very happy with the surgery that was done. So I thought, since I'm doing other kind of academic lectures on carpal tunnel syndrome on YouTube, I would just give a personal disclosure of what happened to me when I had surgery for carpal tunnel syndrome. So you can look up my books if you wish. If you go to Amazon in the search engine, you enter my name, which is Britt, Talley, Daniel, MD, and all my books come up. I have 10 books there, and I have 3 books in what's called the Mini Neurology series, and volume 2 is on carpal tunnel syndrome. And you can get that as a print version or an ebook. So, thanks for listening, and good luck to all you people. It's going to be 10% of the population who have carpal tunnel syndrome. And that's what it was like to have surgery for me. Thanks. Bye.